can hear us? Can you wave if you can hear us? Thank you. And the folks at Burnaby, can you wave if you can hear us? Yay. And the folks at Abbotsford, can you wave if you can hear us? Perfect. Okay. So we're diving in. We have strict instructions to start on time. My name is Lupin Battersby. Thank you so much for coming today. This is Rableen Nagra. We are your hosts for this session. And before we begin, we want to acknowledge that Fraser Health, all of our wonderful sites across the land here, is providing services within the unceded and traditional lands of the Coast Salish people, and we want to acknowledge our gratitude for that. And very, very briefly, we're not going to get a chance to introduce each of you to us, but very briefly, Rableen and I are with the BC Support Unit Fraser Centre, and this particular session has been developed by the BC Support Unit, being rolled out in a number of locations, as well as these ones in Fraser Health. And hopefully you'll see us again. As always, we need to say we have no conflicts of interest to disclose, and we also want to acknowledge that the material for this 1-hour session was informed in part by the Foundations in Patient-Oriented Research, which is a 3-module course that goes over about 2 days. So it's quite succinct in this 1-hour session, but we just wanted to acknowledge that because that was developed through CIHR, the Canadian Institutes of Health Research. This is what our afternoon is going to look like. We've done let you into the room and get you some lunch. I hope everybody's gotten some food. Feel free to hop up and grab some more if you get nibbly as we're going along. And then we will cover some definitions, benefits and values of patient-oriented research, patient engagement, and applying patient-oriented research. We'll give you a quick heads up on some tools and supports that are available. And we will have some chance to get a little bit of Q&A from you. And finally, an evaluation survey, and hopefully you picked that up at the front there. There was 2 sheets, a worksheet and an evaluation. The worksheet we'll be using throughout the hour. All right, so let's get started. I've done the first bit, so we're going to, in terms of introductions to us. And you probably saw this already. This is the learning objectives for the session. I think it was in our promotional materials. And I've kind of gone over it. It maps very nicely onto our agenda, defining patient-oriented research, value, benefits, and so on. So that's hopefully what we're going to make you all experts in by the end of today. So what do we mean by patient? Oh, that was fun. I didn't know that was going to happen. So we mean a lot of things, really. There's a lot of different words that different folks use when they're speaking about patients, whether in their clinical context or in the research context. So often we encourage folks that we're working with to use the language that fits best with the work that you're doing and with the population that you're working with. But generally what we speak to is that when we say patient, we mean anyone with personal experience of a health issue or the healthcare system, or their informal caregivers, and we include that as family, friends, and so on. So it's quite a broad understanding that we're using for the word patient, so it's very inclusive. So what is patient-oriented research? Very simply, it's research done in partnership with patients that answer research questions that matter to patients and aims to improve our health care. So before we started today, we were having a little conversation here in Surrey, and it really is not just about improving patient experience, like our patient experience department is responsible for in Fraser Health. It is really about improving health care by doing research with all of our stakeholders. And it has some roots and some similarity to other areas that you might be familiar with, like community-based research or participatory research. And the similarities are around that collaborative nature or the co-creation and that sort of area. Is a bit different in that we have very specific, or we encourage very specific inclusion, and that is with the what we consider the 4 key stakeholder groups, with patients, as defined earlier, with clinicians, so many of you in the room today, and with decision makers, and with academics. So we're really working towards helping folks bring all 4 of those stakeholders together in the work that they're doing to work in the research collaboratively as a team. And where you may remember, if you've done research methods, particularly in qualitative methods, community-based research has a bit more of a focus on community. And so that might mean that you have, say you're working with the Arthritis Society, as your community, you may have the, say, executive director from Arthritis Society on your team, and now you've got a community member on your team. But for us, we would say, okay, well, that's great. You've got a decision maker maybe on your team, but let's also bring someone with the lived experience of arthritis or their caregiver. So that's the sort of little bit of an example of a distinction between the two. I'm probably talking too long, so I'll move on. Okay. How is patient-oriented research demonstrated? So how do we know we're doing it? These are the key ingredients. You have, as I just mentioned, engaged patients as partners. It often is focused on patient-identified priorities, so that might be that you have a patient partner on your research team and they help you shape your research question. And that doesn't mean that your questions aren't being answered as well, but you're working together to shape a question that's meaningful for both of you. It's the aim is to improve patient outcomes. And as we've mentioned already a couple of times, it's engaging a multidisciplinary team. And finally, the piece that's very important to me, the aim is that you then take that knowledge and apply it appropriately to improve healthcare systems or practice or policy. Okay, so what is patient engagement? The emphasis that we like to put here is that the engagement of patients on your research or with your research team is meaningful and active, and there is a collaboration there, okay? So that might mean that you have patients working with you in your governance structure for your team. Lots of research teams have advisory councils or similar things, or if you're a bigger research team, you may have a number of projects going, and then you have someone, your governance sort of overseeing all those projects, and that includes patient partners. It means working with patients in your priority setting. And I'm really emphasizing, I don't know if you can hear it because it's maybe a little subtle, but an S at the end of my patient. So we're encouraging more than one person involved with lived experience if you can. And of course, in conducting research, that's a big piece that we promote. That's Rableen, myself, and Meg over here. And then in knowledge translation, so that's about bridging research and practice. So if you do come up with some really great findings that you are actively working towards putting it into practice or at least sharing the information, and patients and your other stakeholders can help you with that too. So we really briefly wanted to give you an example within the context of Fraser Health of a sort of exemplar project that did all of those pieces that we just mentioned. This is Dr. Sonia Singh. I guess she's not the medical director anymore, so sorry, that's a slip up on that one. But she is a hospitalist at Peace Arch and has a number of other roles and had been the medical director for the Department of Research and Evaluation up until recently. And she had a project looking at prevention of secondary fractures, and she and a knowledge user in this context is a she's a knowledge user herself as a clinician, but also she was working with a patient partner, identified this care gap within the context of identifying folks and appropriately getting them tested and treated to prevent secondary fractures. And they went out in a big search and found the best evidence pointing towards a solution that could be applied here. And they took that solution, it's called the Fracture Liaison Service, they took that and adapted it for the context within BC and did a project in which they implemented that service and evaluated the outcomes. And to emphasize, she had every stakeholder you could think of on her team. So she had the patient partner, she had surgeons, the managers of the CAS clinics, and so on and so forth on the team. I can't remember everybody, but it's a big team. Then they found out it was really an effective model, and they had great outcomes, so they wanted to sustain the program at PSARCH beyond the funding cycle, and did a ton of presentations. One of the presentations was to the ED at the hospital, and they did this presentation together, Sonia and the patient partner. And so the two things that convinced the ED to take up the effort to make this an ongoing program was that the patient partner was there, so it demonstrated to her it was really important, and that they had really good outcome evidence from the work at PSARCH, so in their context. And this project actually just got another funding award through Michael Smith Foundation to do a scale and spread. So that's hopefully going to be coming to a hospital near you. So keep your ears out for that. So this is your opportunity now to hopefully take that learning that you just did on the definitions of patient-oriented research and just give yourself a little note on that worksheet. So it will be question number 1 of what you learned about the definition of patient-oriented research so far this afternoon. And also the other, I'm looking over there, but I can't see me. Other sites also work on the worksheets there. Note down under number 1. I'm going to give you another like 30 seconds. Does anybody want to just shout out the thing that stuck out for them about what patient-oriented research is? It can be here or in the other sites. I just assuming that you might be muted, so you may need to unmute yourselves. But. Yeah. Oh, you have to press the little red button. There we go.
Yes, of course.
Thank you.
Well, I'd put down the characteristic you'd mentioned about it having a level of authority or credibility and validity with decision makers and people like that.
Okay. That stood out for you? Okay, thank you. We're going to have more time for chit-chat, but I'm going to push along because apparently I chit-chat too much, so I need to make sure that we stay on time. I've mentioned CIHR at the beginning, Canadian Institutes of Health Research, and this is just to give you a little bit of context of why we're talking about patient-oriented research so much today and what has brought us all here. So the Canadian Institutes of Health Research have initiated this strategy for patient-oriented research, which they call affectionately, I suppose, SPORE. And this is basically the essence of patient-oriented research that we've already been talking about, trying to support that across Canada. So this is a national strategy. And within the context of the strategy for patient-oriented research, we have a number of support units, and one of them is the BC support unit. So obviously that's a provincial initiative, and it is a multi-partner organization, and each regional area has a team. And so for Fraser Health, the partnership is between Fraser Health and Simon Fraser University, and you have the three of us and our other team member, Brittany, to help provide services and supports to clinicians and researchers and so on in the region. And really our goal is to support, streamline, and increase the conduct and quality of conduct of patient-oriented research in our community here. So I'm going to switch this over to Rableen and give us 2 seconds while we move this handy-dandy little doohickey.
There you go. All right. I think people can hear me. All right, perfect. So for the next 10 minutes, we'll be talking about benefits and value of patient-oriented research and why do we really want to consider promoting it and actually doing it. All right, so just to set up a little bit of context, referring to the triple aim, the cost of healthcare is increasing. Our need to be effective with our funding is also imperative. It also says that it takes about 17 years for research recommendations or research results to become actual practice by clinicians and decision makers and so on and so forth. So there is lots of gap in terms of the implementation of data and research, and how do we shorten that gap. And we're proposing with patient-oriented research, if we have all the stakeholders present at the table while starting doing research and all the way to the research results, it'll have more of an impact in the implementation and uptake of research results. Last but not least, a lot of times in the research goal, it's been said that 14% is believed to make it into day-to-day clinical practice. So there's about 86%, which just sits there, and it's not been uptake. All right. So this is a very busy slide. So if you can just walk with me, starting from the bottom of the slide, what it's trying to say is that if knowledge users, in this case we're talking about patients and family members and friends, if they are involved in the research processes, they will be able to share their own health research priorities or their own barriers in terms of what their challenges are with the research available so forth, or the care that's available to them. Then it will move up alongside to have the research which will be conducted with their perspectives in mind, so that the research that's going to be conducted will be relevant to the needs of the patients and the other stakeholders in the healthcare system. And then as you go up, it says knowledge users can influence and accelerate decision-making, translations, and uptake of new practices. So the idea is that if we have knowledge users present on the table alongside the other stakeholders, chances of being it implemented into day-to-day practice are higher, because there will be that lived experience expertise in addition to the other expertise that's relevant and needed. And last but not least, the ultimate goal or the impact would be that there will be improved experience for all stakeholders. It will hopefully improve the health outcomes that are needed and make the system more sustainable, because in the end we'll be doing research that's relevant to all stakeholders and providing care that is relevant and needed for all stakeholders. Okay? All right. So I wanted to also mention that the idea of patient-oriented research and the importance of patient engagement in research has been talked about quite lately in terms of the relevance and the impact that it can have. So as you can see right now, I only have pictures of the scholarly articles, but I'm happy to share the actual references with all of you so that you can actually read them, give it a read, and check it out as well. And there are scholarly articles, the CMAJ, I believe, which actually does specific reports and specific papers on patient-oriented research. So that's something that you can check out if you're really interested in using the book for and the impact. All right. So referring back to the scholarly articles that I just mentioned in the picture shot, it identified some of the crucial benefits of engaging patient engagement, doing patient engagement in research. So the idea is it enhances quality and relevance of research. So if you have patients on your team, they will be able to share their barriers and challenges, and this will hopefully enhance the conversation that's taking place because each stakeholder will be bringing their expertise. So academics will bring their academia expertise, clinicians will be able to share their challenges and needs from the research project with their clinical expertise, and having that lived experience on the table throughout the project will hopefully share the perspective of the patients at the end of the client's perspective. It expands the applicability of research. It empowers patients to support implementation of findings in practice. So one example could be that if we know that if patients and families know that this research was done with patients in mind and with collaboration with the patients, there are more chances for them to actually embrace that research recommendation. So it enables user-focused research objectives and questions. It will be able to be user-friendly, so if we're creating documentations that are relevant to the public, creating it with them and wording it to what they find applicable and relevant will be helpful in actually implementing it. Last but not least, it increases study enrollment rates. So that's something that I encourage researchers who are looking to engage with a specific community to always have patient partners on their team, because if you're looking at, for example, an HIV-positive community or LGBTQ or any kind of specific community members, it'll formulate that trust and it'll formulate that, that space that you are doing your due diligence to engage with the members of the community as partners, and hopefully then they will be able to recommend and foster that connection with that community for future data collection. All right, so there's pros and cons for everything. So we've mentioned to you some of the important benefits that come from patient engagement, and what are some of the challenges or the things that we need to make sure that we do them effectively to do the patient engagement. It does require some extra time and funding, both of them which we can help you with, because BC Support Unit is set out for a provincial scope, and we are available to help clinicians and provide that support throughout the province of British Columbia. The overarching worry of tokenism. So a lot of times when we have researchers who have been doing this for quite a long time, but they're engaging patients in a different way, patient-oriented research, they're worried about tokenism. We just don't want to have one person on the table and check that off the list. And how do we make sure we do that in a meaningful way so it works for both stakeholders? There's supports available, there's resources available, and there's in-person training that we can also provide to make sure that you're doing it the right way and you're getting the support that you need, both for patients and families and for clinicians and researchers who are looking to do research. The struggle with relinquishing control and managing those research project scope can lead to conflict. This is where the need of being flexible comes in and being open. So for example, if you are looking to do meaningful work and you want to engage in that lived experience, the idea is to be open to understanding what their barriers are, because as a researcher, sometimes we know what the result could be, and we're kind of working towards that. But once you have a lived experience on your side as well, that will hopefully improve your chances of understanding what the real problem is or what the real issues are so we can address them through research. Tensions between academia for quality research and user perspectives. So that's something that comes from having a wide range of stakeholders on your team. So making sure that there's that, it doesn't talk about it here, but we do have these things called the guiding principles that we always encourage researchers and research teams to abide or encourage to use them, so that it formulates that common understanding of what our common goal is, coming from different perspectives and wearing different hats, and how are we going to achieve that as a team. And a lot of times there's also research support available for patients, because they might come with a think of changing the world with that one research project. And the idea is to having those realistic expectations and making sure that everyone's working towards the same initiative. All right, now that I've talked at you for the last 10 minutes or 5 minutes, can we refer to our question number 2 on our worksheet? And if you can maybe identify any benefits of patient-oriented research that might click with you or that you might want to look into for your work that you're doing in research. You're welcome to write them down. And also the other sites as well. You're also welcome to write down any questions that might be coming up for you. I know we have a Q&A at the end of the presentation, so this way you'll write them down and you can click on the other. I'll give you 10 more seconds. Good. All right, while everyone is writing them down, is there anyone who would like to share them out loud? Over here and with our other sites as well. You can just yell. I don't know how to unmute you at this point. Can you unmute them? All right, now I'm just looking at you guys. Perfect.
I'll share. I liked hearing that having patients involved helps identify issues that matter to patients. And the idea that having patients will increase trust and study enrollment rates will increase, that sounds good too.
Mm-hmm. Thank you. Great. Okay. Wow, this is so fancy. Okay, all right. We're going to move on along. Perfect. So the next thing that we're going to talk about for the next 10 minutes is, now we talked about benefits and why we want you to do patient-oriented research, and now we want to make sure when and how you can actually engage patient partners in research, and then point out some considerations in terms of ethical and cultural ones to make sure that you are able to engage with them effectively. All right. So again, this is a very busy slide as well, so walk with me here. We're going to start from left to right. So that, in the highlighted black area, is basically the research cycle as to when we figure out there is a clinical problem or there is a problem that we want to address or research. As we go along from left to right, there's all these steps that we take as researchers to be able to find a solution, come up with recommendations, produce some results. Okay? And on the top and the bottom, as each step moves along, at the top and the bottom, we have some roles and responsibilities that might be very relevant to having a patient partner on your team. So for example, coming up with, so you identify there's a problem, there's lack of uptake or something, and now you know that you want to dig a little bit deeper, and how are you going to do that? So with the research question, having a patient partner on your team will help you phrase that research question, especially if it's focused towards a specific community. How do you want to phrase that research question that will make sense to the community that you're trying to work with? Which way do you want to make it specific? What are the priorities from the research questions? The research questions are usually very umbrella type, and what kind of main identified or priorities that you want to work on through your research project. And patient partners can share their barriers and challenges and their needs that might enhance what you're already thinking of. It might confirm things for you. It might add to the confirmations that you might already have. So that's where patient partners can come in. And as you go to the right, there'll be more action. So there will be study design. What kind of study design do we want to do? If we want to do focus groups, would that help if we have a patient partner on our team, because they can help us write the questions in a way that makes sense for the community members, right? Of course, we can try to write in a way that would work in our understanding, but how can we make sure that it makes sense to the other stakeholders? can't go through all the slides because I only am given, okay, a couple more. All right, so securing funding. So a lot of research funders, for example, CIHR or Michael Smith, they want you to have patient partners or knowledge users on your team. So that will justify that, okay, whatever project you're working on, you have the knowledge user on your team as well. And also what happens is a lot of those funding bodies have patient partners as their reviewers, part of their review team. So you might have your research proposal which you have come up with, a patient is looking at them to make sure that you get the funding. And how can you make sure that you get that? By having a patient partner on your team who can read and see and understand what you're trying to get. The hope that when a patient reviewer is looking at it, they'll be able to understand what you have written down in your proposal. Okay. As you go along, study setup, ethic approval, conducting the study themselves, having a team patient partner on your team is always helpful throughout as you do your team meetings, and having them engaged throughout the research process. Analysis, again, if you're doing some qualitative research data, then it would help having a patient partner on your team because they can understand the underlying connotations that might come along with qualitative data as an interviewee or a focus group. Okay? Last but not least, I will jump to the change in practice. So that's where Lupin's role as a knowledge translation specialist comes in handy, because once you produce the results, it's relevant, it's needed. Now, how are you going to make sure that it gets to the right audience so that it's used and it's implemented? And having a patient partner can definitely help with that as well. Okay. All right, moving on. And there is a reference here as well, so you can definitely see where this slide comes from. All right, so now that I've sold to you, obviously, that you definitely have to have patient partners on your team, now I'm going to tell you what are the things that you need to consider before you start that patient engagement process. So our hope and our goal is to always advocate for engaging patient partners as early as possible so that they can share that lived experience and become engaged with you at an earlier start date so that they can be there for the whole process. Identify patients with related lived experience. So all of us have experience with the healthcare system. All of us can totally qualify as patient partners. But the question is, are we qualifying? Do we have the experience that we need for a particular research project that we're talking about, right? So each research project is looking at a specific community, specific population, and we need to make sure that the patient partner has that relevant experience. One of the other things that I always mention is having one or two patient partners is always helpful. So having a patient who's been through that diagnosis or that problem, and having their caregiver, such as a spouse or a daughter or a son or whatnot, who have that caregiver experience. Because when they are in the hospital, the other caregiver is trying to figure out the system and how to make sure they get the care that they need, right? Of course, considering their ability, their skills, their familiarity with research and language. So they are set for success. And in order for us to be able to do that, we are able to provide all that support for you to identify the patients, making sure that we provide training and support for the patient partners so they know what they're walking into, communicating in plain language. So that comes from acronyms. We all love acronyms. Making sure that we identify them, explain them, so that all the team members understand what they're talking about, right? And plan for patient orientation. This is also something that the support unit can help you with. Ideally, what I do is I usually do in-person presentations for each research team as it comes together so that everyone starts on that level playing field and everyone can ask any questions or any kind of inhibitions that they might have before the process starts. All right. Now going forward to the ethical and the cultural considerations. Thank you. All right, so considering power dynamics. So of course, if a patient partner is walking in by themselves into a team where there's lots of clinicians and lots of doctors and everyone has a PhD or a MA or whatnot to their name, it might become overwhelming. So what I always ask is introduce each other with the first name basis. So everyone has a first name, and if you introduce that, it makes things a little bit manageable, especially if it's the first time a patient is coming to a research project, right? If it's a seasoned patient partner who has that previous experience and whatnot, they might be a bit more comfortable, more confident to kind of stand their ground, right? Potential experience of stigma. So of course, if you have if it's a project with a specific need and they've experienced stigma and they have to relive that stigma as they share their story, so having that consideration as well. So if they're sharing their personal story at that one point, make sure you're listening, not on your phone, and giving them that respect and the time that they need to share their lived experience, right? Avoiding tokenism through effective engagement, and we can certainly help with that. Potential barriers, so if we're looking for young mothers, then they have kids, that's why they're mothers. We got to make sure that we don't schedule a meeting at 9 a.m. on a work day, and they have to have daycare. Or making arrangements or funding provided to them so they can take care of daycare and come in and have a meeting. So as you engage a patient partner, they're part of your team. Just like you'll check with a clinician as to what their most available time is for you to meet, same thing will be applicable to all team members. Right? Cultural norms around appropriate engagement and participation methods. This is very important when it comes to, let's say, Indigenous engagement, right? So they have their own cultural norms, and one of the things that I've learned so far is always being able to ask how they would like to be engaged, and then kind of going from there, rather than coming up with already a plan, which is great. A lot of times we are planners. We like to do things as we go. But if we're looking for a meaningful engagement, we have to make sure that we're doing it in a way that works for both parties. Right? Consider heterogeneity within cultural or ethnic communities. That's important when you're looking for a specific community, making sure that there's diversity around. One of the things that I also like to clarify is that having one or two patient partners on your team does not mean that those two patients have to be representing the whole community that you're working towards. Just like having one physician on your team doesn't really represent all the physicians and all of their input, right? So having two patient partners is the constant patient voice on the team, and that is what it's there for. So there's a little bit of clarification there. Last but not least, having that patient partner compensation and reimbursement of expenses. So if we are having in-person meetings, make sure the patient partner is not out of pocket. So mileage, parking, bus fares, things like that. And then in addition to that, we also have a compensation policy for our honorariums to show gratitude. So of course, you can't really pay a patient for 2 days of their actual work, right? So it's supposed to show gratitude. And it varies for each patient partner, and I can definitely talk more about it. I can't really go into further details, but there's lots of resources available for that. Okay. All right, now I get you to do more work for me. So if you can refer to the third question on your worksheet, and maybe just outline some of the considerations that you will take into account when you engage with patients next time in your research or project. And then we'll follow suit as last time. So write it out. I'll ask one person to yell it and answer. And I welcome Royal Columbian, Burnaby, or RCH to kind of jump out with an answer as well. What can I love it. All right. Do we have any volunteers from all the sites, any of the sites, to share one consideration?
At RCH, we were talking about having more than one patient partner, and also knowing that one patient doesn't speak for all of them. Just,
yeah.
And to avoid tokenism is a big one.
Perfect. Thank you. Perfect. I love it that they're participating. Yay. All right. So moving forward, we're going to get Lupin to come back and share a bit more about POR.
You're the yes, I know. I was just looking at the thing. Okay. Thank you.
All right.
So actually what we're going to next go into is a little more discussion. So get ready for more contributions from the other sites and from Surrey here. So you'll see on your worksheet a couple of more questions. If you just take a few minutes to think about a research project that you've done or you're doing or you would like to do, and how, or a project that you think you would like to do where you could apply patient-oriented research principles or ideas that we've shared today. And think about how you could do that as well. So the first one is think about that project, and the second one is how you would make that happen. And this idea of setting a goal for yourself is a great way of moving out of this day with an action item for yourself, so you can carry it forward beyond this, this 1 hour lunch session. It could be to follow up and call Rableen and ask her for patient engagement strategy development. So, you know, there's something. I'm going to give you a few minutes to write that out, and then we'll have some time to share and talk. I'll give you 10 more seconds just because I've got a second-hand clock up there. So we can have a bit of a chat. So I'm not expecting you to have written a full research proposal yet. We need at least another 5 minutes for that. But I would love it if someone was able to share some of their ideas, either on the external sites, so RCH, Burnaby, Abbotsford, or someone in the room. Even if it's just a note of thinking, oh, you know what, I just thought of this project that I could put some of these principles to use. Yeah, go for it.
I'm a physician doing the physician quality improvement course in September, so I'm going to be doing follow-up conversations to find out how I can tap into these resources in a project that I'm thinking of starting up in fall. And that is with our unique breast health program at Jim Pattison, where we're doing mastectomies and reconstructions on an outpatient basis, and that's not the norm nationally or in North America.
Oh, okay. And so you already are doing a unique...
We are already doing it, and I think there's room for improving the patient's experience in terms of postoperative pain.
Okay. Okay, that's great. And do you have any ideas off the top of your head as you're thinking about that project, how you might include a patient partner with you on your team? What do you think? What contribution might they make, or how might you go about it?
That's why I'm here today. I would love to have more than one patient partner on that. I'm a little anxious about how the clinical colleagues will feel about incorporating a patient. There's a range of personalities, and I look forward to assistance in making it a success.
So that I'm not sure if everyone could hear over there. I know you have a little microphone, but so you're a bit concerned about how the other folks on your team might feel around bringing a patient voice as part of the team. Is that what you said? Yeah. And so you're looking for ideas around that. And Raveline was, sorry, they're not going to be able to hear you on the phone, so press the little button on the microphone.
Yeah, just referring back to what you were mentioning, and one of the things we always are happy to do is the in-person presentation. So I know that you'll be able to speak with your colleagues, but if they're open to having a 20-minute conversation with us, we can always come in and do a little mini presentation for them as well, so they can kind of hear it from us and then ask any questions that they may have for us.
Any other ideas that folks want to share, or projects they think they could bring the patient voice to? Yes, yeah, press the little button.
I have a question, and maybe obtain some of the benefits of the concepts you're telling us now in the type of research I'm involved with. An example, let's see, we're testing a new medication for congestive cardiac failure.
Okay, new medication.
And it is a study that cannot be done in 10, 20, or 200 people. We need 10,000 people.
Oh.
Therefore, the project has been organized in an international group, and the participating centers are all over the world. We are one of them, and we have a protocol to follow, a strict protocol that has been discussed by all of us participants in special meetings before the project, and we recruit patients. The part of patient-centered research that can apply is what we already do a little bit. We engage the patient on the question study. We engage the family, the caregiver. We tell them, we explain to them so they can understand and give us the consent. But be compassionate about all that. We provide help, parking.
Mm-hmm.
Ethically, we cannot give any salary. No monies are allowed.
Mm-hmm.
We can retrieve, we can give them whatever expenses they incur into.
Mm-hmm.
In this type of settings, I have difficulties in getting a way to get a patient as a partner of the whole project.
So,
as a partner of what I'm doing, I want to recruit more.
Yeah.
So I can tell them personally maybe the concepts you're trying to get, but officially, is that
Right.
a partner really?
No, I would say it's not. So absolutely, we always have to be taking consideration of our patients that are participants in our research, which is what you're talking about, and a number of the respectful ways that we treat our participants in research are potentially going to apply when we engage patients as partners in our research. So there is that similarity there, but there is a big difference in that we're talking about bringing the patient partner in as a team, which I'm hearing you say that sounds like a challenge in doing this kind of clinical trials type research. And we were actually just recently having this conversation about clinical trials and how, where could a patient partner fit in and at what stage, because often there is, like you said, a protocol that's international. So the thing is that there's pieces of the project that are yours, that are here, and that potentially may be relevant to have a patient partner involved. But I think to avoid the tokenism that we talked about, you don't want to involve a patient partner on a team just because you want to look good. It does need to be meaningful. That said, there are a number of pieces in your protocol that you could potentially get that sort of advisory perspective from a patient that may be relevant to this context and that may be different, in Germany or something, wherever the other sites are. So you can get the ideas, like what's important to the patient in terms of their experience as a participant. We know, certainly thinking about recently, we were talking with folks doing research related to HIV when they're doing their projects in Vancouver. The folks that they're recruiting there as participants have different concerns and issues than the folks in Surrey. So then you want to, if they have just patient partners from Vancouver on their team advising them on how to engage and speak to the community, then it's not necessarily going to be relevant to the folks in Surrey. So that's where you could get some benefit from engaging a patient as a partner on the team. But it is very important to make the distinction that we're not talking about participants. There is a real clear distinction between participants and patient partner. Do you feel like I've said enough? I feel like Meg wants to jump in, so we'll let her, and then we'll move on.
I just wanted to add, like, one simple way that a patient partner could contribute to your study is having a local perspective on even where to promote for recruitment. So, you know, within their own patient network, who do they know, and, you know, do they have a Facebook group for cardiac patients? Is there a community organization that supports, you know, either family caregivers or cardiac patients? Is there particular sites where they might see a poster where there are other similar type of patients that you wouldn't necessarily know about unless you consulted with them? So even that, as a, you know, even though you already have a protocol and you have, you know, there might still be some tinkering at the local level that could happen with the advice of patient partners.
Thanks. And I'm going to cut you off, Kathleen, just because of time. But yes, and there's lots of opportunity to follow up with us because we are very accessible and available. So feel free to, any questions or thoughts that didn't get answered or explored today, drop us a line. And on that note, I wanted to give you a sense, we keep talking about how we're available for stuff. We haven't really let you know what that stuff is. So here's services. So we, as I said, are part of the BC Support Unit, and you can see the sort of unit-wide services under that side, and then the Fraser Centre specific. Patient engagement is across both. We also help you with recruitment, onboarding, training. Rableen does that kind of work with you. She's mentioned some of that already. Training, we offer training, and as does the support unit, has some other training as well, and there's also a number of webinars and so on that are already online that have been posted there that you can go and view. There is training for and access to REDCap, which is like a survey tool, data collection tool that you can use for patient-oriented research. Knowledge translation, training and resources, as well as support around strategy development. And research methods support, so that can be around patient-oriented research support, but also you know, how to link some, like those sorts of ideas that you're talking about. How do you link in patient-oriented research into the type of research that you're doing now? At the main office there, there's some work going on around pragmatic clinical trials. Please don't ask me about it. That's the one thing on this list that I don't feel confident to speak to. And of course, for your research proposals, not only can we help you with letters of support if you're interested in doing patient-oriented research, but we can give you some feedback on your research proposal as you're developing it, particularly areas that can be tricky sometimes are your patient engagement sections, and Rableen can give some great advice on that, and your knowledge translation sections as well, and then bringing that all together. And we also help with facilitating collaborations with other stakeholders, such as perhaps you need an academic partner we can help you, work with you to find somebody at SFU is our strongest connection, but we also have connections at other sites such as UBC as well. And also the Fraser Centre does provide a number of patient-oriented research funding opportunities, and so does the support unit. Has one main one that they do through Michael Smith Foundation. So if you're on that mailing list, then you will. It's P2P. What does that P2P stand for? No, it's not Pathways. Anyways, it's on the Michael Smith website, P2P, and it will. You can see that the most recent competition and look and see who won it, and that can give you some ideas for your future, as well as on our website, which is through the Department of Research and Evaluation. We have a web page there, Advancing Patient-Oriented Research. So if you Googled Fraser Health Advancing Patient-Oriented Research, you'll find us. You can also go here. So this is the BC Support Unit website, and click that little inquiry form button and fill in an inquiry to let us know what you're looking for. And the handy thing about that, too, is it gives you a little test run of REDCap, because that's a REDCap form. So you can see what it will look like if you decide to use that particular resource. And you can ask for any of the services that we've already mentioned, or just a consultation, just to have a chat and get things started. Oh, no, we did not mention that. It is not associated with any cost, so this is free. If REDCap can have a cost if it's not patient-oriented, but if it's patient-oriented, then that is free as well. And by free is this we are providing infrastructure support. This is what our job is within Fraser Health and the Fraser region for the Fraser Centre, and the BC Support Unit is here. So we are a federally funded resource for you to take advantage of. Yeah. And also on the website are resources. So if you click that there, you'll get some access to resources. It's, you can sort of go as wide or as small in terms of your search on that one. And we also have a new service called this Electronic Communities of Practice. So if you are working with a diverse group of stakeholders, you may find it's challenging to figure out where you all can share files and keep track of meeting minutes and so on if you're all from different sites or have different firewalls or what have you. So you can become a member, and then you can have access to this Electronic Community of Practice space, and they'll help you create, like that. This is through the hub, the main BC Support Unit office. They will create, it's almost like a wiki page, I guess, kind of, right? Like they'll create one of those for you and help support that. It's quite easy to use. Whew. So as you can see, I did not catch up any of our time. We have like about a minute left for questions, so I apologize. So what I'm thinking to do, to be very mindful of time, and because it's really important to us to get feedback, because this is our first go at doing this particular 1 hour session, is if you can complete the survey, and then if you can ask questions and answer questions at the same time, then you could shout out any questions that you have. And the other sites, I think you should also have the survey on hand printed out there by our lovely librarians. And so if you could complete the survey and give it to one of our hosts, that would be beautiful. And if you have any questions, just shout it out.
Hi there.
Hi.
I'm wondering what kind of projects would not be appropriate to have a patient partner involved?
I would say that probably most projects would be appropriate. It would be, it's more about how you do it. Okay. But I think you know, I think for some people they might feel like there's some that aren't appropriate, but I feel like basically anytime you can have a stakeholder involved in your project, then you could have a patient partner involved in your project. Yeah, it might be that you just tweak what the involvement is, like maybe you don't have them looking at the slides of a organism, but you still have a discussion around what the importance of that is.
And our job is to make sure that we can make a project patient-oriented. So if you have a project, come talk to us and we can talk about how we can engage patients in that as well.
Yeah, so we're not so good at discouraging people from patient-oriented research because our mandate is encouraging it.
Thank you.
Yeah. Thank you for the question. So when you finish your survey, feel free to hand it to your local librarian, who should be in the room with you. In Surrey, Sarah is in the back. And if you have any questions that you don't feel like you have time or want to answer in this venue, like I said, send an inquiry form or just email us. What? Oh, the next slide has our... There you go. So those are our email addresses on the slide, and as well, Gabriel, who made all this magic happen for this particular session. Yeah, are they providing the slides? Oh, on the back of the handout are some references. Was it all of them?
I noticed that
So it has all the specific links, but if you're referring to specific scholarly articles, sure, I will email them. I'll email Gabriel and it to everyone.
I forgot we had done that. Fraser Health, oh yeah, Fraser Health Research Week is next week, starts next week. It's 5 days, over 2 weeks. And there is a patient-oriented session on the 7th. Yes. And the first day is on the 5th. If you can access that through Learning Hub. It's open to everybody. If you go to learninghub.ca, and I think if you search Research Week, you should find it. And day 1 is point of care, and day 2 is patient-oriented research workshop. Day 3 is keynote day, and that's at the Sheraton Guildford. And that's a very popular session. It's usually our biggest well-attended session. And if you go to our fraserhealth.ca research website, it will also have a link to Research Week. I think it's like under knowledge translation and events, and then it'll take you to Research Week. Everybody. So thank you. So the last Friday tends to be geared to more clinical trials folks. That's day 5. But day 1, 2, and 3 is open to the public, and but specifically, historically, it's usually Fraser Health clinicians and staff that attend the most. But it is open to the public and decision makers and SFU, basically anybody in the Fraser region, even actually other health authorities. We get folks from other health authorities as well. So anybody can come. Yeah. And the keynote day is usually very well catered. So. Yes. Do you want to add that to your list of things to email? And email maybe even just directly the research week. Yeah. We send everything to Chris, so. Yes, that's right. The research department also has a newsletter, so if you want to sign up for that. Thank you. Yeah. Absolutely, yeah. Yeah. The patient-centered care. I think there's some history connection, but it's not. Yeah, it is sort of I would say, an overarching model of research that's not a research method per se. It's not like. Yeah, it's like this could be applied to any research. Yeah, like patient-centered care. Yeah. But I'd say the patient-centered care model is different than the patient experience focus of the healthcare system. So those are different too. I would, yeah, there is definitely. I think it's like a zeitgeist, you know, like it's finally all, yeah, all of these areas are coming together to